Hi, I'm Daniel Nyman. On behalf of the Forum for Healthcare Strategists, as well as our colleagues at MIQ, welcome and thank you for joining us for the Healthcare Marketing Puzzle, Measuring the Impact of Advertising. From researching early symptoms to scheduling an appointment, patient journeys are a complex puzzle with pieces spanning online and offline experiences across multiple channels. Programmatic advertising allows healthcare marketers to engage patients throughout this intricate journey, gathering data across every interaction that contributes to the overall picture. Yet measuring the value and impact of media effort remains a significant challenge. With the help of today's speakers, you'll learn how to assemble the pieces of your marketing measurement puzzle so that every interaction contributes to a clearer and more impactful overall picture. Our speakers today include Julie Simpson, Associate Vice President, Communications and Marketing at UF Health Jacksonville, Jim Brown, CEO and Partner at MBB, Ted Sweetser, Vice President of Advertising, Partnerships and Strategy at PurpleLab, and today's moderator, Oscar Rondon, Senior Vice President of Product and Partnerships at MIQ. One note before we begin. If you'd like to ask a question, please enter it into the question and answer pane located at the bottom of your screen at any time. Our speakers will respond to as many questions as they can in the time we have. With that, I'll turn the program over to Oscar Rondon, who will be leading today's discussion. Oscar?
Thank you, Daniel, and to the Forum for Healthcare Strategists for hosting us. And thanks to everyone for joining us today. Welcome, everyone. Welcome to today's session on healthcare marketing and the challenge of accurately measuring impact. Along with our partners, Julie at UF Health, Jim at MBB, and Ted from PurpleLab, who you'll hear about later today, we're here to try to explore together how we can better understand the effectiveness of advertising campaigns in the healthcare space. And our goal is really to spend the next hour or so educating you on the complexities or the puzzle pieces that you have to fit together to do accurate healthcare marketing, alongside with introducing an innovative measurement solution from MIQ, which we call Hospital and Doctor Influence, or HDI for short, that helps you drive stronger performance and ultimately ROI for your campaigns. So to get started, let's talk a little bit about the challenges that you're facing, which are plentiful, right? You're marketing in a very highly regulated environment with intense scrutiny by the government, by other parties that want to ensure privacy for patients. Separately, there's fragmentation both across media consumption and the way that you plan your campaigns, whether those be brand campaigns or specific service lines. And ultimately, what we know is the biggest challenge is that there's few measurement solutions out there that can help you prove the ROI of your media investments and move from having that conversation of, I need more budget for advertising, to move to, I've actually driven more sales for our hospital system. And so what we know is that the biggest hurdle today is that difficulty in attributing paid media to actual ROI, specifically in terms of insurance claims, which is a primary revenue source for healthcare providers. Despite the fact that 90% of hospital bills are covered by insurance, there's really been no reliable way to directly link media exposure to these claims. But that's effectively what we're doing here at MIQ. In response to this challenge, we've developed something called Hospital and Doctor Influence measurement, which is a revolutionary step in solving the challenge of ROI attribution for your media campaigns. So let's talk a little bit about what's changed and why the need for HDI today. So in the next slide, you'll see that advertising has changed dramatically. As someone who grew up in the linear TV space and really understands the value of linear television, we know that linear TV is just not working as hard as it used to. And so folks have moved on to a variety of different channels. And this is the fragmentation that we're talking about. We're living in an online, on-demand world, and media is being consumed across multiple channels, including all the ones that you see here. So that makes your job so much more difficult. It's really hard to navigate that complexity because there's different selling paths. There's exclusive partnerships in the space. All of that to really say that we're living in a programmatic ecosystem. And a programmatic ecosystem is one that's a real-time biddable environment where every impression counts. We understand a little bit about who's behind the screen, and we then buy impressions to hit your KPIs. Unifying that on the front end for planning and understanding where your audiences are across this landscape, and then on the back end for reporting is really hard. That's why you need partners like MIQ in the space that help you navigate this complexity. So let's talk a little bit about who we are. MIQ is a programmatic media partner, and for the last 14 years, we've been partnering with brands and agencies to deliver the best performance on advertising campaigns with outcomes that matter to them. Specifically for healthcare, we've worked with over 230 different healthcare brands, and we've ran nearly 4,000 campaigns where we leverage our vast array of agnostic partnerships in the space for execution, where we build technology to understand audiences on the front end and for attribution reporting on the back end, with the best people in the business. We literally have dedicated healthcare trading experts. We have a full service creative team, and we have in-house compliance teams that ensure we meet industry regulations. So everything is copacetic. So let's talk a little bit about what we do at MIQ. At MIQ, when we tackle a vertical, we tackle all of the challenges that marketers and agency partners face, which is really across the programmatic and social channels that they want to execute. We help them by creating solutions that allow them to plan, activate, and measure more effectively. So let's start on the planning side. It really starts with better connectivity between direct-to-consumer audiences, so those consumers that are buying your brand, and HCPs and those providers that are actually prescribing your brands, alongside with the hospital systems that are actually the providers of the care that those consumers seek. And we do this through audience insights that are powered by our healthcare data spine, which I'll get into in a second. But we take all of that intelligence and we put that intelligence to work by creating specific audiences that can run across multiple DSPs, across multiple channels. And we're constantly monitoring performance so that we can optimize based on the performance of those campaigns to ensure we're hitting the KPIs you want. And we even leverage AI in all of our targeting. And finally, this is where it gets really exciting and what I'm talking about today, which is we bring it together to deliver better measurement, covering the entire patient journey, including our exclusive first-to-market HDI solution for measuring hospital visits. So now you can see your entire marketing initiatives and how they're working across the funnel. So you might think, how do we do this, right? And doing this is not very easy. MIQ's healthcare data spine is the way that we achieve all of what we're talking about, whether that's planning, activation, or measurement. Planning is driven by MIQ's robust healthcare data spine, which breaks down typically siloed data sets to provide richer perspectives on patients and provider audiences. So how do we do that? We're taking a look at TV signals. We have the largest TV data spine in the United States, covering over 50 million households. So we understand where you're buying your linear TV impressions, what's the effect of that. We understand where people are consuming across the streaming ecosystem, and we know how to drive incrementality. And since we know that in the healthcare space, we can't really do one-to-one targeting of consumers because of the regulatory concerns, we use contextual cues to really understand where we should be placing these ads. And that's based on content, right? So for example, we can understand when people in specific markets have driven, visitation to a specific site. So let's say they're looking at diabetes.org. Then they're moving on to foodnetwork.com and looking for sugarless recipes. All of these cues allow us to understand a little bit more about these patients and start building audience segments that capture, those folks wherever they're consuming content. And then the way that we do this is by creating these cohorts. So we understand geographically defined groups of patients, right? Based on those characteristics of where they were browsing. And we're using ZIP3 data to segment them based on attributes like patient conditions or behaviors, or provider specialties. But we also know that healthcare marketers rely and trust third-party partners. So with our model of being agnostic across the space, we work with third-party parties, which are essential to your strategy. So you can leverage IQVIA or Crossix segments, but what we're most excited about is our unique and deep partnership with PurpleLab that allows us to build these cohorts, right? Leveraging a best-in-class solution that is taking a robust view of all healthcare claims across 12 different sources of tokenized claims, reaching 300 million anonymized US residents, which represents over 85% of US claims. So the healthcare data spine is quite large. We're then leveraging some publicly available information, right? So we understand the doctors leveraging their NPI list. And we use transaction data to understand what consumers are buying at retail pharmacies. So we understand those shopping behaviors. So that's really what healthcare data spine is. It's an amalgamation of all of these distinct data sets that we use to understand media consumption and then understand the claims that were provided. It combines all of this data, whether that's claims, purchase behaviors, media habits, to provide a unified picture of all the healthcare interactions across different channels. And this data spine, alongside with medical and environmental factors like the weather, helps us reach specific audiences more accurately with creatives that resonate. So what we've done is created something called Hospital and Doctor Influence Dashboard. This is a tool that gives a comprehensive view of the patient journey that links ad exposure directly to patient actions, all while upholding the strictest privacy standards. So let's talk a little bit about how that data works, right? So let me talk to you about the patient journey. The patient journey really starts with some cues about who they are, right? So if you click one more time, you'll see patients are browsing, right? They're hitting websites. We're understanding the websites that they're visiting. We understand weather conditions in specific zones. So we understand if, allergies are popping in the south, or if there's snow in the Northeast, which is causing people to have more flu-like conditions. We understand those websites and the searches that they're engaging in. And so to the previous example, we understand when they visited diabetes.org, when they went to Food Network for a sugar-free recipe and whatnot. Using our healthcare data spine, which I just described, we're taking all of those cues about what they're watching on television, what they're surfing across the web, what they're buying at a local pharmacy, and we're putting all of that together into our healthcare intelligence platform. That's where we're solving the biggest piece of the puzzle, which is we're taking signals and inferring who these patients are to then build targeted campaigns. From there, we create specific audience segments. And when we create those audience segments, we start running impressions across the programmatic ecosystem. That includes channels like connected TV, digital out of home, programmatic audio, display, social, right? And on the next step, you'll see that after those impressions are run, really now the patient takes over, right? A patient has to decide to seek care, right? What we understand at that point in the process is that we can target healthcare providers, right, with our solution in specific geos based on their specialties. And we can serve them creatives that resonate to them. Like a diabetes doctor would see something that's a medication for diabetes versus someone who's in the orthopedic space and would see a more targeted ad for their specialty. And finally, after a patient seeks care, that's when the magic starts to happen from a measurement standpoint. A claim is filed, and our partners at PurpleLab are aggregating all of that claims data from those multiple sources that I mentioned, representing those 85% of US claims. And on the next side, you'll see that regulation is pesky, and we have to account for that, right? And so what happens here is that this is the part where regulation takes over. We're not allowed to see who has a specific condition. I cannot target Oscar who has diabetes, for example. So what MIQ does is that we send our media campaign data to a third-party agent. That third party takes the data and de-identifies the data. And then leveraging our partners at Datavant, That data is then tokenized so that we really don't understand who that person is. That data has essentially been stripped of all PII, and that token gets returned to PurpleLab. Once PurpleLab has that token, that's what helps feed our MIQ HDI dashboard. That's where MIQ can start to see the attribution of the claims based on the media that we ran and start to show you ROI, okay? So let me talk to you a little bit about our HDI platform and how it works. We're taking all of that data, right, which is impressions and media IDs, we're sending them to those trusted compliance partners. Those compliance partners are taking that data into anonymized patient tokens, right? And PurpleLab is matching all of those tokens to doctor claims. MIQ is uninvolved in this step to ensure the highest level of privacy and compliance. But once that data is processed, we start on solving our pieces of the puzzle, which includes understanding what type of claim it was. So we're looking at ICD-10 codes, which, as you know, exist for every single condition. We then start looking at the public NPI registry to understand who the provider is and what their specialty is. And we're then looking at facility information, addresses, affiliation to larger hospital systems. And all of those puzzle pieces come together in our HDI dashboard that delivers actionable claims-based measurement insights. So let me show you what that looks like. We've developed HDI to help you as a marketer prove the ROI that directly links media exposure to these patient claims. This dashboard essentially is real time, right? On 1 month, it's on a 1 month delay, and we have a 6 month look back window. So we can start to see claims based on the exposure to the ad. The dashboard provides insights into patient touch points, and those are broken down by specialties so that you can help grow specific service lines like radiology or internal medicine or family medicine. And we then start telling you which were the best channels that helped drive those claims, right? So MIQ, in partnership with PurpleLab and Datavant, we've created this unique solution that matches the programmatic media to those insurance claims. And this innovation really provides a clear view of your return on ad spend, far beyond traditional vanity metrics like click-through rates, which are not effective at measuring your campaigns. But on the next slide, wouldn't you want to know how you're performing relative to your competitors in market? We can do that too. So essentially, what our platform does is that it tells you how many claims each of your competitors got by service line. And then we take a look at how those claims have changed over time to account for any seasonality. And down to a geo level, we can help say which specialties resonated the most across which channels. So this HDI solution really enables us to connect all of this rich ad exposure information with real patient visits and claims, providing the true impact of your media efforts. This is going to be a game changer for healthcare marketers who today struggle to justify spend and optimize for better results. So finally, the proof is in the pudding. With our partners at MBB, we've developed a case study. And in this case study, you can see that for a recent campaign that ran for several months, our approach linked over 3,800 patient claims to advertising exposures, which means that they got 3,800 new claims based on their ad expenditure across CTV, OLV, display, and programmatic audio. So going back to TV and fragmentation, CTV drove a lot of those results. But ultimately, this is what HDI is meant to do. HDI helps you solve this puzzle that is healthcare attribution measurement so that you can drive better outcomes for your hospital systems and for your brands. So now I'd love to invite my speakers to join me for a spirited conversation. So as we go along, they'll introduce themselves. And to my fellow panelists, I would like you to answer one icebreaker question as you introduce yourself. Since we're on the topic of puzzles, if you had a 1,000-piece puzzle in front of you, what's your strategy for completing it? How do you start? So Julie, why don't you take us away? Oh, Julie, I think you're on mute.
I do that every time. I said, I'm Julie Simpson. I'm with UF Health Jacksonville, and I am all about the edges and the corners. I predominantly am in an administrative role with marketing with my large group, and I need a framework. I need a framework for every campaign that I start. I need a framework for every process that we're putting in place. And that's one reason that we're choosing to work with MBB and MIQ and PurpleLab is because you help us provide a much better framework than what we've had in the past.
Wonderful. Jim, on to you.
Yeah, Jim Brown with MBB, a partner here at the agency. And I learned at the feet of my grandmother and my mom, so I'm an edges guy. I'm not fantastic at puzzles, but certainly enjoy doing them.
Wonderful. Ted?
Ted Sweetser, VP Ad Strategy and Partnerships here at PurpleLab. I always start by turning over the box and looking at the whole picture.
Wonderful. Cool. Well, let's get to answering some interesting questions for everyone who joined today. So, Julie, I'd like to start with you. Obviously, data privacy regulations make targeting patients across the full funnel like really challenging. How has UF Healthcare approached this challenge?
Well, first of all, very conservatively. I think that is the biggest thing that we've been taught in the healthcare arena is you have to be incredibly cautious and you have to be prepared to be able to answer the questions as to how you got what you got. And so it's been very frustrating in the past because it's very difficult to track return on investment. And it's just been incredibly challenging to try to get to a point where we can actually say, we've brought this amount in. It's, we've always been considered a cost center, not a revenue driver. And it's time we change that mentality. And so by working with different providers such as yourselves, we're getting more in alignment with that. But again, it's very challenging. And so we're excited about this potential.
Wonderful. And Jim, you work with numerous healthcare clients to develop targeted strategies, right? That address like the complexities of the patient journey. How do you do that? How do you balance investments across, traditional and digital channels, across the programmatic ecosystem? And what metrics do you look at when you're crafting those plans?
Yeah, in an oversimplification, it obviously varies by client, right? And almost all the healthcare systems that we serve, and I suspect that are represented on the call today, by and large, they have reputations in their marketplace. They are probably a large employer in their marketplace. And as an agency, you're sort of meeting them somewhere along that journey. And so I think the work that we do, certainly with Julie, but with others, is really understanding our strategic position in the marketplace and how much of the work we do is around brand and how much of the work that we do is around driving volume. And tools like this really answer sort of the holy grail for us, which is an understanding not just of marketing or vanity metrics, but of business objectives. So depending on who we're serving and where they sort of sit in their position in the marketplace, that media mix is going to vary, whether, again, sort of determined by the objective of the dollars that we're spending. And I think what we're talking about today is really twofold. Is like, how do you weave together that patient journey? How do you weave together their, relationship with the health system? And that's one side of this equation. The other side of the equation, I think, that is more critical to this is visibility into that, right? Like we have a pretty good idea of how to engage our patients. What we don't know is which of those are the most effective and which of those are actually driving an outcome. And that's where we're at with PurpleLabs and MIQ, is that we can say, okay, here's what we've put into the marketplace, and here's the performance that each of those levers is driving for us. These are thought processes that exist in almost every consumer category, but for healthcare. And so I think, as Julie alluded to, the industry has always been conservative. I think it's rightly conservative. No CEO or CIO wants to end up on the front page of their paper. But I think what really starts to differentiate the outcomes of your effort is building education and building trust inside of the organization, so that when we come to them and say, hey, here's what we want to do, that we're going to get the opportunity to do that.
Wonderful. Yeah, that's a great perspective. Ted, from your side on PurpleLab, like, has that been your similar experience? Like, what are the key data points that healthcare providers prioritize when measuring the success of their campaigns? And how have you approached reporting on marketing performance overall?
So it's interesting. Investment in the healthcare marketing space have often been driven by life sciences brands in particular, who are interested in launching new drugs to market. And there's a specific calculus used to really understand ROI in that space, which is driven by an understanding of, new patient starts, wholesale acquisition costs, and the length of time that you have under the patent window to maximize the value for the brand. And importantly, while you do have variations in, ROI by, say, PBM negotiation, there is a larger framework which is consistent across any patient start, which is they're going to be on drug X and they're going to be on this for, Y period of time. For providers and integrated delivery networks, you have an entirely different model, which was, I think, under-investigated, at least when we began this process working with our partners at MIQ. And that is that, there's a tremendous variation in ROI calculus across different service lines and treatment categories. And all of those need to be evaluated when you're really trying to understand, how you're driving success in a given market. So working with, your organization, one of the key learnings is, we need to have a framework that appreciates, more at a almost like an RVU level, but like at a service line level, at least, what is the relative value of patient acquisition and the long-term value of building a brand where, a patient doesn't come to you just for solving one thing, but for, treating the wide variety of things that we all require across our lifespans.
Right. Great point. And Julie, how does that play out when you're marketing a whole system rather than a particular hospital? Like, how do you sort of justify your ad expenditure?
That's always been really challenging. We have tried a lot of the old-fashioned ways. I've been in healthcare marketing for over 30 years, and so that certainly has changed over time. It's to a point now that, we absolutely have to be able to demonstrate what we're bringing into an organization. Money is tight in every healthcare organization, and, usually marketing is the first place to be cut. But what I'm finding is the more information that we're able to provide to our CFOs, to our CEOs, and to just others in the network, the more they see the true value. And you're really lucky if you have a CEO like I do who gets it, who doesn't just automatically think this is a cost or an expenditure, but it is truly an investment. And so I think the more that we're able to bring that information to the C-suite and to the executive table, that's what our responsibilities are. We need to be able to document what we're doing and how money is being spent, and more importantly, most importantly, how that's contributing to the growth of very specific service lines.
On that note, I did think I left out a lot of the historical approaches to understanding your impact. I think have been very qualitative based, a lot of research into sentiment analysis and surveying to get back brand reputation opinions from the population that you're working within. What we're doing here now is intended to be much more of a quantitative approach to really turn ROI from just a broad objective into an actual numeric outcome of a dollar in gets you what amount out. How much is that transforming from your experience in the space, Julie?
Well, I think in all my time in healthcare, I've only had a couple of true opportunities where I've been able to say, I spent X amount of money, and we were able to track that through a very small number of patients to the final outcome over a year, for example. They bought what I would consider a loss leader test. We tracked the 200 people or whatever bought that test for $49. And because we knew who took the test, we were able to follow them and ultimately have that final outcome in a year. This is how much money was spent. But that was so time intensive. It totally negated the ability to do it over and over again, and certainly never on a large scale. So that's one reason I think this technology and the use of this ability is really going to be crucial for us as we move forward. Not only does it really help us utilize our dollars more effectively, because we can do so much audience segmentation, but we also have the opportunity within a 30-day time frame to move and shake as we need to if we're not hitting the audience properly. So I think anything that you can use that meets all of our conservative standards of not violating privacy are things that we have to use from a marketing perspective, because healthcare is competitive. I mean, it is very competitive. We may not like to admit that all the time, but it very much is. And we need to use every advantage we have moving an organization forward.
Yeah, wonderful. So I wanted to double click on something you mentioned, but specifically for you, Jim, since you're sitting at the nexus of like client requests and then, vendor management, when you think about, sort of the measurement capabilities in programmatic advertising, how did you make recommendations to your customers for what channels to use? And then ultimately, how is HDI helping to sort of introduce a new level of attribution to those programmatic campaigns?
Yeah, I think as soon as as Julie alluded to, I've been at this for 20 years, maybe 25 at this point. So Ted brought this up, right? Everything we had done up until 10 years ago was pretty anecdotal, right? I think that the health system sort of intuitively knew we need to spend money, we need to build a brand, if for no other reason to keep their doctors happy, right? So that, obviously we've had marketing budgets for a long time. And with the evolution of programmatic, then we could start to go back to our clients and start to deliver vanity metrics, right? Like here's how we're performing in display, here's how we're performing in social. And I think for a number of years that satisfied people, right? And it probably satisfied them for two reasons. One, it was better than anything they had in the past. And two, they didn't really know what the expectation could or should be. So now we have tools that are evolving like this, and we are, I consider us early adopters for this, but the reality is the industry is going to continue to evolve in this direction because the C-suite sort of needs and deserves answers to this. And in any other category that you work in, some level of understanding of cost per acquisition is sort of inherent to the business model, and that has not been the case in healthcare. Now as it continues, as reimbursement rates continue to decline, as it's just getting sharper and sharper out there, and poor operators are going to struggle. And so I don't think the difficulty, and Julie, you correct me, I don't think the difficulty is sort of selling in the concept. Everybody wants the concept. The difficulty is really selling in and making sure that the CIO, the CEO, the CFO, that everybody is comfortable that we are not going to violate any privacies, and comfortable, that this is going to perform well without putting anybody at risk. I think the other problem that we have with healthcare marketing is the industry. It's not just the outside of the building, but it's inside the building. And it is by and large still a very siloed organization where you've got marketing, planning, business development, all sort of in separate buckets. And that doesn't even include the CIO. So I think the hardest part for Julie or for any other marketer is weaving together that group internally to sort of hold hands and say, okay, we feel really good about this decision. We feel safe about this decision, and it's going to pay off with the kind of data that we need.
Wonderful. And thank you for being early adopters. I know that's never easy, right? We have heard very similar concerns from client legal teams. So I wanted to double click on that for a second. So Ted, this question is primed for you, right? Like, can you walk us through, like, how does PurpleLab really ensure that patient data claims, remain secure and anonymous while still providing all these valuable insights that we're talking about for healthcare marketers?
Yeah, I think one of the first things is always to make sure that you don't do it alone. As in a lot of healthcare, a second opinion never hurts. So, we work with an extensive network of legal organizations, third-party reviewers, as well as We're recently members of the NAI to, ensure we're following best practices. But essentially what it begins with is when you develop a product or a component of a product, as we have for HCI, privacy is not a secondary consideration after you've designed a workflow. You have what is commonly known in product as a privacy by design attitude, where you assess the implications of every component that you're putting together, especially with regard to, like a concept of data minimization, understanding that our end outcome, the cover of the puzzle box, to use the beginning of this conversation as an analogy, the end that you have in mind is answered by the product you design, but that there aren't ancillary, puzzle pieces, which in this analogy would be, extraneous bits of data included in the process because it's not necessary to the function you're trying to accomplish. So for this, I think what we looked at was, the goals of an ROI analysis are conceptually similar to a lot of what we see in the payer provider space in terms of population health analytics, where understanding that the patient journey is exceptionally important and tracking for outcomes, but understanding, that an individual in question had such and such a patient journey, gets us into concerns about privacy. So with that as a framework, what we worked through is, how can we, go through de-identification, go through HIPAA expert determinations of the full process to understand that each component is not dragging along any extraneous information, and then that the output is suitable for the objective, but doesn't, again, yield up any additional information, which would put us at risk of re-identifiability of any data.
I do think, Oscar, that was a bit of a eureka moment for me as we were going through this process, is sort of the recognition that this thought process, if not this exact technology, is being used in other parts of the health system, right? We're really just now making it more available to the marketing department, right?
Yeah, understanding these principles, has always been important for guiding investment. If you're going to put $100 million into a new medical center, you need to understand what are the largest service lines that are, growing, what's their anticipated population level in the area where you're going to actually build that physical plant. We're just doing the same thing with, marketing analytics.
Right. That's a fair point. So Jim, how do you think like a solution like hospital doctor influence will impact your clients' outcomes like going forward?
I think that I think the ROI element of it sort of just is beneficial on its face. I think everybody gets that. But at a level deeper, my hope is that it puts agencies and marketing departments higher in the value set inside of their own organization, right? Like when hospitals talk about CMOs, they're not talking about chief marketing officers. They're talking about chief medical officers. And I think folks like Julie have fought very hard to get at the table. Tools like this, I think, will help get them, he or her, at the table on a more regular basis, because we are now deeply impacting revenue. I think we always believed that we were deeply impacting revenue, and now we can prove that we are deeply impacting revenue. And hopefully that changed the value of the CMO inside of the healthcare organization.
Right. That's wonderful. So Julie, turning it over to you, but what's UF Health's leadership response to the measurement you've seen through HDI, and how will this impact your future marketing plans?
We're just now really starting to share the information. So I can't really say that, I think they're excited about it from the standpoint of what the potential is. We have shared it with a group of fellow marketers within the system, and they are very excited to see it as a possibility and what we have to move forward with. We're getting ready to really start segmenting a second component of our plan. So we're very anxious to see, we've taken a look at it from a brand perspective. We're getting ready to take a look at it from service line and how we're actually driving that growth. And I think when we're able to get to that point, we'll have much more information to share and actually be able to really dazzle some folks with what we're able to put together. At least that's the hope anyway.
That's our hope as well. So we're excited to be partnering with you and with MBB on future campaigns. So Ted, talk to us a little bit about how does HDI compare to sort of existing measurement solutions, and what do you think we could do next?
Yeah, so I think we're really breaking new ground in terms of converting, you know, hospital performance from a qualified to a quantified outcome, and that has a lot of implications. One of the first ones is that as you have media fragmentation across the ecosystem, the value of, existing channels is actually diminishing. It's not remaining agnostic, because if you'd put, your whole budget into linear buys 20 years ago, you'd be on pretty safe ground. If you did it last year, you would have missed, something like 40% of your audience. And if you do it next year, you'll start missing a lot of the seniors as well. That is, it's a threat and an opportunity, as there are more efficient ways that we can now quantify for engaging your audience. Just as importantly, changes in consolidation in the provision of care mean that there's more opportunity than ever for, integrated delivery networks to consolidate their media and get the most, impressions, the most value from what they're doing. So, you still have systems that operate with investment at, a single hospital level where, you could be consolidating and operating and negotiating for media spend with 10 times that amount via, your integrated whole market spend. Bringing these, data points together, you can now make the case for doing that more effectively, and for having much more insight into what at each of those local market levels is going to be most performative. On the privacy side, as we'd hit before, we only want to collect and measure what is safe and secure for us to collect and measure, and that proves out the value of media investments. Accordingly, this workflow doesn't require storing, the PII or PHI of individuals in the systems in question. Without a CRM system, it becomes fairly low lift to implement, and therefore, can be a lot more agile and adaptable to the business needs. We're talking about IDNs now, but if you represent an organization with a specific service line, these capabilities can be applied to that business as well. Yeah, sorry, Oscar.
Yeah, no, that makes a ton of sense. So knowing that all of these measurement options are available now to sort of help prove ROI, Julie, I guess I'm wondering, how are you going to strike that balance between the silos, right? Internally, of like balancing, I don't know, system-wide growth versus individual hospital growth, versus other metrics.
Well, I just need to say, I represent UF Health Jacksonville. This has not been implemented in the system yet. And so I have always tried to be a very early adopter of technology and measurement components. So it's probably easiest to say that we're really working to make this work, so that we can then share this information across the system as needed, and as certainly as we think that they'll want to grow with us. But again, we're in the early stages, excited about what we've seen so far. But I don't want to project too much at this moment. I tend to hold things close to my chest, so we'll have more to show or more to talk about the next time we talk.
Wonderful. Looking forward to that. Jim, how do you think you can leverage this across multiple clients at the agency?
Yeah, I think so. We are starting to share this with other clients based on the successes that we have had to date with UF. And again, I think everybody's very accepting of it and very excited about what it can do. I think as an agency, and particularly, sort of depending on the strategic situation of our client, we'll be pulling this levers in different ways. And maybe that answers the next question too. I'm like, where do we see this all heading? There's also a very sincere reality that in a lot of these marketplaces, that access is an issue, right? Whether that's primary care access, whether that's specialty access. And so I think what we will always be trying to do is help. It's like a load management tool, right? Like, how can we help them gain volume where volume is needed, and then sort of, govern or make sure that we're not hurting the user experience by over-promising in a certain service line where we don't, where an appointment might be 6 months out. And again, I think that tech tools that get as granular as this tool does allows us as agency and marketing department to really try to get more effective at lead generation in those areas where we need lead generation.
Right. Yeah, that's a valid point. In fact, a great segue to a question that I saw come in, which Ted, I would love to sort of get your perspective on. So there's a question from Valerie about targeting, right? And the ability to withhold control groups to analyze the impact of marketing in the claims data. I know technically that is possible from a targeting perspective, but I guess the overarching question is, should they be doing that and why?
Yeah. If we talk about measurement methodology, I'm sure I'm going to get people disagreeing with me somewhere in this panel. If you ask two, statisticians an opinion on the best approach, you'll get three answers, to borrow an old joke. But certainly we can hold out what's commonly referred to as a holdout group from commercial engagement via, digital channels. Depending on your media mix, that may or may not be fully true because, a billboard is a billboard and I'm not going to be able to hide it from people per se, but we could certainly hold back, a component of the marketing question from, digital engagement for purposes of control lift analysis. The other option is, you can go dark in certain markets, especially if you have marginal, actual adoption in those areas. It may be de minimis in terms of the efficacy of your campaign, but still serve effectively, given the scope of what MIQ can measure across competitive brands, to talk about the impact that has. There's also, on this scale, pre and post analysis might not be entirely hurtful as long as you can time align it so that you're not letting seasonality, throw some fuzz in there.
Right. Yeah. I think from our perspective, while it's possible, like that's one of the things we're working on is providing you those geo level insights down to the specific service lines versus your competitors, so you understand what creatives are resonating in what zones and which ones are driving the most growth for those service lines. So we'll continue to expand the product to offer even more insights into 2025. Cool. Well, before we close out, I guess one question for everyone on the group, and we'll start with Julie, but going back to the analogy of this webinar, which is, solving the puzzle pieces. So what's the next puzzle piece or the next major challenge for healthcare marketers?
That's a really big, broad question. Every day is different and every day there's something new that comes up. I can honestly say probably one of the biggest challenges is AI, keeping up with technology, keeping up with the newest mediums that are made available. This really dates me, but when I started in healthcare marketing, we had billboards, we had newspapers, we had radio, and if you were in a really big market, you had television, and that was really it. Today, there are just so many options of how to advertise, how to get your message out. And I think you just have to be really smart about it and use the tools and techniques that are out there and available. I trust MBB, so I push all of that off onto their responsibility and said, give me the very best mix. Let's see how we can measure it. Let's see how we can optimize. And the other thing is real time. To me, it's really important to have as much real-time information as possible because, if you get information, when I first started in healthcare too, you would get information a year later on whether or not you moved market share or whatever. That's just not effective. As everything in the world has sped up, that's one of the other things that I think is just going to be more and more crucial for us is to be able to see real-time information and bob and weave as necessary to hit the best part of the market.
Wonderful. Well, I would argue that all of those mediums are still available. They're just programmatic now. So, which makes it more flexible. And the ability to serve like real-time creatives is definitely here and now, and can help sort of drive more patient visits. All right, Jim, how would you take that question?
I think that where I would love to see it go, and again, there's plenty of earth to trample over with what we're doing right now. I'd love to get to a point of predictability, right? Like, how can we help the system manage not just the performance of yesterday, but help them get some visibility into what the performance of tomorrow looks like. So there's a lot of data pools that are coming together with their EHR, with opportunities like MIQ has offered here and with PurpleLabs, and then just other open source opportunities that we could, I'm not saying we'll predict it with 100% confidence, but can we get to 85% confidence that this is what tomorrow holds versus what yesterday holds?
Love that. Progress is definitely here, and we should be taking advantage of all of the AI and tech options available for advertising now. So I love, sort of hearing that you're willing to try it out and know that it's much better than the other options in market. Cool. Well, Ted, what's the next big puzzle piece, next major challenge for healthcare marketers?
Major challenge for us is really on the ROAS side of things, understanding the influence of the payer puzzle piece in, profitability and success of a business in the long term. It's a whole other side of the world for us, but, understanding, based on negotiations and the actual, billable amounts that we observe, how, the growth of a given payer in a market can impact the profitability and success of a healthcare system is an area that we invest a great deal of attention to and expect to see a substantial amount of impact from in the next few years.
Wonderful. Well, thank you all for joining us today. We really appreciate the time. I'll pass it on to Daniel to see if there's any other questions from the audience that we can help take.
Yeah, thank you, Oscar. And just a reminder, if people want or have any extra questions, just enter them in the question and answer pane. I think we have time for a few questions here. So we'll start with this one. I think I'll pose it to you, Oscar, and then if you want to farm it out for the appropriate responses. But is it possible to take the tokenized data to delve deeper into the full downstream revenue generated by each patient who comes in from a campaign? Or is it just the number of patients who come in, the highest performing channels, et cetera?
Yeah, there's different ways to sort of slice and dice the data. I would say the tokenized data allows us to understand most activities. Like, there are certain activities that we don't track. Like, what I mean by that is, for example, we don't track sort of phone calls to doctors' offices where a patient might be requesting to make an appointment. We really track it at the claims level once that appointment has already been fulfilled, which quite frankly is the way that, the hospital systems generate their revenue anyhow. But we are looking at sort of expanding to capture more patient touch points, but today it's really based on that claim.
Okay, great. All right, Julie, we have one for you here. Do you have any success stories that you can share that have been significant in your campaign measurements? Like what service lines, et cetera?
Well, we launched our brand campaign last March, and that was the first time our hospitals have been in the market in a while. I mean, we've done small things, but we hadn't done a very large brand campaign. So we're kind of getting back into the market. So I would say that, yes, we saw success with brand, but one of the main reasons we launched this with brand was to give us a baseline as we begin moving forward with very specific service line campaigns. And those will actually start in January. And so we're very anxious to see what we were able to get. We were pleased with what we saw from a brand perspective, enough so that we decided to move forward with service lines. We're going to be very targeted in terms of service line by zip codes for specific services, as well as just very, very specific areas to highlight things. So more to come. Wish I had some, great magical story to tell you, but I know we've been very pleased with what we've seen so far, and we're kind of new into this. Jim may be able to share a little bit more information.
Yeah, I think that we have had, quote unquote success. And I think it's important for every organization to define what success looks like for them. Yeah, as Julie alluded to, UF Jacksonville has not been a big time spender in the last few years. So again, we're trying to sort of reposition it without going deeply into their strategic situation there. Just trying to reposition the success of the organization as an academic medical center. I think the other thing that I would say to anybody who is looking at this is I would not let great be the enemy of good. What MIQ is and PurpleLab have brought to the table here is, this is not a sales, but I guess it's a sales pitch. It's so far ahead of what we've been able to do in any type of visibility that we have been able to have into performance. I think the critical thing is if you are considering these kind of things, find a partner that you trust, find people that you think are sincere players in this space, and then start the process, because you're going to end up competing against yourself, right? Like, this is all about incremental growth for your health system. This is all about stealing share in various areas. So what they have developed a better mousetrap at the end of the day.
I'll follow up on the question to Oscar for a sec, if you don't mind.
Go ahead.
We're part of finding someone you trust is making sure that all parties involved are not considering privacy as a negotiable element of the conversation. To the question of, can you understand the exact amount being billed for any given claim? Sure, it's possible. That's not necessarily something that we would include in the scope of an initial ROI analysis. And, if that element is essential, it's something that we will think through as part of the privacy impact assessment. To that extent, though, all of the provider side people on this call, give it a shout out, know that when you bill a payer, that is not the same as what the payer will actually pay you. So the claim itself has the amount that you believe is billable. You will get the amount back in remittance data, which certainly we and others have access to. But a lot of that is negotiated in a variety of different fashions. So if you want to get to an ultimate, like, what's the actual dollar value thing, it's a complex conversation we're always happy to entertain. But it may be secondary to actually understanding the signal, which we're interested in, which is, does marketing drive engagement for this healthcare system, and what elements of the marketing were most effective? That being said, happy to discuss afterwards if anyone has questions.
Based on that description, I would say we've been very successful. And credit goes to MBB. They really helped us build a really fantastic brand campaign, and have really breathed new life back into an organization. Very excited about it.
Okay, great. I think we got time for one last question here. It's in a highly competitive healthcare market, often oversaturated in larger cities, and a lot of digital noise. Which tactics are you using to stand out amongst competitors?
I'm happy to take that as we work with folks from sea to shining sea. I don't think that there is a singular tactic that we could point to and say this is the golden ticket. I think that what we're constantly doing, whether it's with UF or other clients, is not just measuring the tactic chosen, but the messaging that is running inside of that tactic. And so I think if your agency is not taking a test and learn approach and feeling comfortable to fail, that's when you really need to start to ask the questions, because we're not just testing media, we are testing messaging as well. And obviously, again, speaking for the agency, that the tighter the health system can be and who they're chasing and what they really stand for, the higher your success rate will be. That said, it's still very difficult.
Yeah, just to ping on that, at the point of the dashboard that these guys built is, like, omnichannel is not just a buzzword, folks. The media fragmentation is not, like a conceptual affair. It's the different audiences who, by their natures, social determinants of health, will constitute different potential visitors to your healthcare system, are going to be optimally reached using different tactics. So what you really have to be able to do, to Jim's point, I'm going to say it for all of us in the back again, is figure out the right content at the right time on the right channel. And the way that you do that is by trying to understand specifically for your system, you know, at a service line level, what does the population look like that's getting care there? And then can I map back my media engagement to how well I'm actually saturating and engaging that specific population? After that point, you do need to start getting into media pricing analysis to understand, you know, as a combination of viewability and addressability, what are the best channels in this market to get the greatest return for my client? Sorry, I'm a little passionate about that subject.
All good, Ted.
Yeah, no, thank you. Thank you for that response. And I think this brings us sort of to the end of our time today. So I'm sure the audience joins me in thanking Julie, Jim, Ted, and Oscar for that terrific discussion. And thank you to everyone in our audience for taking the time to join us today. Please note if you asked a question that we weren't able to get to, we'll do our best to get a response to you. We'll also be sending out a link of the webinar recording, so watch out for that within the next few days. That concludes today's program. We hope to see you at future forum webinars, as well as the Healthcare Marketing and Physician Strategy Summit, April 30th to May 2nd in Orlando, Florida. Please visit the forum website at healthcarestrategy.com to learn more. Finally, be sure to give us your feedback by completing the evaluation survey as you exit the webinar. Thank you and have a wonderful day.